I'm happiest when I am problem solving, and that is what emergency medicine is.
I love being able to do a quick procedure and make that pet feel immediately better. You can watch them take a big breath. You can watch them become more pink and more lively. So I like being able to put the pet in the right direction and make them feel better.
When you're coming in through emergency service, 99% of the time, we don't know what's wrong. So we see the whole spectrum of things.
We're always happy to kind of work as a team and figure out, does Fluffy need more diagnostics? Do we need more answers? Looking back on the couple of days, like, have they been eating? Have they been drinking? Have you noticed any vomiting?
Sometimes it's as easy as a broken toenail or a Band-Aid, right? And sometimes, unfortunately, my patients that come in are not having a great day. We have nurses and doctors that have this huge, broad spectrum of knowledge, and it's really impressive to watch them come in, get even a small amount of information, and already hit the ground running with an idea and a treatment plan in mind.
We do in-house blood work. We can do x-rays, ultrasound.
The emergency service is going to utilize that point of care ultrasound on most of our emergency patients. So abdominal or thoracic fast scans. It's mainly so that we can look for fluid in places it doesn't belong.
I love the technicians that I work with. In human medicine, our technicians are more equivalent to like a nurse. I'm asking my nurses to place IV catheters, start fluid lines, get blood pressures. In some states, if they're licensed enough, they can place nasogastric tubes and help do minor procedures.
It's the doctor-nurse team that makes sure that we are taking care of a patient's complete needs while they're in the hospital. Typically, the big distinction between emergency and the other specialty services is emergency is our starting point. We are traffic control.
I can triage and stabilize and then give it to the correct department. I'm able to work more with the surgery team, the oncology team. We have a critical care service. We have ophthalmology. So we're able to work with so many specialties in one hospital during the daytime. That's very, very useful.
Nothing can exist in a vacuum in a veterinary hospital. And that's the appeal of BluePearl, is that you can come to one building and have all of these different specialties at your fingertips.
I really enjoy helping owners understand what's going on with their pet and then helping that pet feel better. And even if it's not an emergency, the owner thinks it's an emergency, so I can help say, hey, the next time they do this or they look like that, we can figure it out. Because I see the relief that they get just knowing that their pet is either okay, or if it's not okay, I can help them through that process.
There is no small animal veterinary medicine without the owners, right? These patients can't advocate for themselves. I feel like one of the things I'm really good at is helping them understand and making them feel like not only they understand the problem, but that they're going to be a part of the solution too.
I've always been attached to pets. That's why I'm in this field, is because I have a connection to them. So I find a lot of gratitude and drive for what I feel like is a calling that I have to help pets in emergency situations.
That's why we all do it. We're here because we care about your pet and we care about you, because none of this happens without you.